You literally save somebody at high
The guy was legit choking. Something stuck inside.
on the our Superman. Quite a big guy.
Came from behind.
Oh, intimate.
You kiss him, it was my off day. 300 swab, so I came back, stay back to work until 11 o'clock.
Some people think GPS give meds, take MC only.
Memorable case. Yeah, it was very.
Hi guys, welcome back to episode 2 of Take MC. Here today we have our special guest, Adeline. Hi. Adeline is basically one of our most senior staff in Etern Medical.
The oldest one.
Pioneer generation really.
Oh, pioneer. So we brought her in to show us and show you guys how working in Etern Medical is like. Okay, so firstly, we just want to ask you, so far, how long have you been working in Etern Medical?
17 years.
Wow, that's a lot.
17 years, more than a decade.
Ancient.
Wait,
Yeah.
NG, sorry.
More than
15, this is 16 now.
3 more years to 20 years old.
Yeah, so here for 15 years in Etern Medical, how do you find it so far?
Definitely there's up and downs. Yeah, up is when everyone are very family, being together, and progress together, we work together, we go home together. Yeah.
So it's about the togetherness that you like.
And of course, my boss is a very family man. He not only take care of work with the staff, he also take care of me and my family as well.
Alright, so we understand here, we already know that you are a CE, correct? So maybe for people who wants to know what is the working structure is like, and maybe what is the daily task basically is like. What you can tell us what's your day-to-day activities?
Day-to-day activities, of course, operation readiness, and ensure that there's sufficient staff and people that schedule on a roster turns up for work. Yeah.
So for those who don't know, we have different, I wouldn't call it ranks lah, but basically we have different levels of expertise and different responsibilities. Here, with the first is CA. Everyone who join us will start as a CA, which is clinic assistant. Then we have the CC, which is a clinic coordinator, which is actually our co-host Francan here. And we have our CE, which is our clinic executive, which Adeline is here. So Ada as a clinic executive is basically in charge of all of us lah. She's our supervisor.
Yeah, mother hen.
Yes, our mother at work actually. So maybe for those who are interested, right? I think some people maybe wants to know what nursing or is like, or what healthcare is like. I mean, we from our previous episode, you know that Franco is already a phlebotomist. He has a whole large experience. But what about people, right, who are interested to come in but they don't have any experience when they come into medical? How is it like?
So far, we will start them with basic like triage, registrations. And we teach them like how to take height, weight, BP. And of course, registration now is quite a big spectrum because due to the health SG. Yeah, so there's a lot of segment that they need to read and understand. And of course, we will guide them daily in their own in their work.
So are they supposed to do any clinical like duties?
Yes, of course. There's some clinical duties that we will allocate different sessions depending on their roles and the strength of each staff.
So what examples of procedures that they are able to do?
Oh, we can teach them like how to do like spirometry, ECG, and now we have a new nebulizer. Yeah.
This is Dr Lye's new latest toy.
Yeah, correct.
Nebulizer. Okay.
Respiratory care.
So this nebulizer actually a lot of people with asthma that have to do, right? And some people think it's only in the hospital, but actually in Etern Medical we do a lot of procedures. Some additional that I add on to what others say, we do BCA, we do force deck, and we even have some of our staff that can do phlebotomy.
Yeah.
Yeah, as you all know, Francan can do. Ada also can do. And Ada, actually one bonus question. Are you a clinic nurse?
I'm not a clinic nurse.
But in Etern Medical, does Dr Lye consider Ada as a clinic nurse?
Yes, she's a very, very competent clinic nurse based on the numbers of years of experience. His clinical experience is appropriate for our practice. Yeah. So certainly she qualified for the professional part. that our practice requires lah. Yeah.
And some people will ask, right, is there any difference, you're not being certified or you just like as a medic background or this, is there any difference between having like a certified clinic nurse, like enrolled nurse, or this?
I think that one is mainly more like legislative, and the general practice in Singapore, we don't have such fine combing up to this morning the minister mentioned registration of psychology service. They are starting to is because the government see there's a need to fine comb. So that has not happened in general practice yet in terms of fine combing, to legislate to fine comb the industry lah, right? There's good and bad. The good thing is that we have the opportunity to bring in totally newbies, right? People with no industry and they just want to try out and see. So it's very accessible in terms of job experience, right? Of course, the clinical part, how does it work, right, is that the government expects the staff to be answerable to a supervisor, right?
Okay.
And then the supervisor being the doctor. Yeah.
So the doctor holds the responsibility.
Yeah, correct. So how does the doctor see the staff on day-to-day performance? Right? If the staff performs to the standard expected of MOH, like safety, like completeness, things like that, then if the doctor is satisfied that this staff is can achieve the standard as per MOH, he's good to go lah, under his supervision, right? And then of course sometimes we have to read between the lines. High risk things that is impossible to do in where there's a 1% chance of risk, we shouldn't be doing in GP lah. For example, intravenous therapies, there were death cases mentioned. I think there was some aesthetic clinic or something like that. So for diagnostic wise, I think it's very safe. Diagnostic services, even though it's clinical, it is very safe because basically it's taking out sample right? Take out blood, urine, stools. These are very safe, right? Whereas injecting chemicals into patients, then you will realize that we become very strict. For example, vaccination. Even though vaccination is just injecting liquid into a arm, it's highly restrictive. Even Miss Adeline is not allowed to inject vaccine. Only registered nurses are allowed to inject vaccines.
So there are certain things that Adeline can do, and there are others that only nurses can do lah.
There are many things that non-registered nurse can do in our practice. Counseling, patient counseling is because people are forgetful. So sometimes after the doctor say one time, patient just cannot remember. So they will call back, they will ask again in the counter, and we need experienced people who knows the text to reinforce to the therein comes where the experience count more than the qualification in that sense lah.
That makes sense lah. For people who don't have experience, how do you train them up? Do you guys have like a module for them?
Yes. We have protocols, we have standards, we got tests, and then we have ground staff to get them on, because we do adult learning lah. It's more like an adult learning kind of thing. OJT, on the job training. Adult learn by on the job. The task is not complicated, but it's because of safety, because of efficiency. That's why the mastery is required lah. If you can do it, but if you do it slowly, patient will complain, your colleagues will complain, right? In terms of completeness of the task, you deliver 9 out of 10 things, one thing missing, then it won't be right also lah. Things like that. So the task is not complicated, but the mastery needs a lot of practice, and it must be 99 to 100% up to there. Otherwise, it just becomes commercially unacceptable.
So for people coming in, right, do you have any certification for them for any certain specific procedures that they are doing? Like, do you send them for courses or anything for, let's say, somebody interested to come in, but they have no background, but they are willing to learn?
Usually it's trained in the clinic.
So it's clinically trained?
Yeah, we clinically train ourselves. So we give them modules like drug training, counter trainings, even like offhands, like do like ECG, all this. We do have a chart book for them to clock.
So there's a lot of guidance lah when you come into the clinic.
Yeah, until they are familiarized with the item or the procedures, then we'll let them do by themselves.
Okay, so trading aside, when working in Etern Medical, what's the key clinic experience that you have remembered? Like anything that's for memories that you have.
Probably the most memorable one was the 200 to 300 swab per day during the COVID time.
Oh.
Yeah. It was actually my off day though.
Off day.
Yeah, I took leave on that day, but because due to the overwhelming swabs that we had to clear that day, so I came back, and after I did call a few staff, and I think 5 of us stay back to work until 11 o'clock to clear all the swabs, including the forms to send to the labs.
It's interesting how you noted the best part of Etern Medical is working more. It's working extra for that. So why do you feel like you like to take all this extra work? Is it like a sense of duty or
Sense of duty, yes, and I think it is part of my passion in this job area.
I feel like working in this line, you need a lot of passion also. I mean, especially as a doctor, right, Dr. Lye? Yeah. So what about your own as a doctor, your own experience? Any like funny patient or
plentiful, yeah.
Maybe you can name 1 or 2 instances.
Plentiful. Memorable moments. COVID was very scary. Very scary.
Back COVID
like especially the early days where things are very spooky. Suddenly anybody is positive, and then we got no mask. That time no mask. Mask, no diagnostic. So and the first wave, the Delta was lethal. It's not what's the current one? I can't remember. Omicron. Omicron was the mild one. Delta was the lethal one. So that time the Alpha, Beta, Delta, that time was a bit scary.
Just before
that was
the
really scary.
All this also.
Then Francan not scared. That time he's still young, right?
Well, I think Francan wasn't with us before during the COVID time, right?
I was with MOH.
MOH. So maybe how you can share what's the difference MOH and working on the ground like this?
So the difference is I go to the houses to do the serology. Yeah, so they check in the clinic, we go to the houses, to the hotels to check. Yeah, earn a lot of money.
Just serology meaning blood test?
Yeah, blood test.
So do a lot of blood tests. So that's
very
major experience.
The very beginning, right? Very beginning was very complicated. Yeah, super complicated.
Yeah.
That was before Swabs happened.
Yeah, then that time MOH was paying 20,000 per frontliner if you get COVID. Yeah, I was trying so hard to get COVID.
If you get COVID?
Yeah, but I didn't get it.
Your immune system is strong.
I only managed to get a $5,000.
Oh, okay. I mean, since you're over here, the only thing I noticed is like you actually attend to a lot of cases in Etern Medical. Right? I mean, one of the most significant ones was the one at Seletar Mall, our outlet. I think Dr. Lye was there also. Was it during the fainting case?
Oh yeah. Me and Francan.
I think
actually, me and Adeline also, and that's Dahlia. We have this staff called Salia, Adeline. We also did a resus. So if you stay long enough, you will have the ultra memorable cases. It was very traumatic lah. This one was traumatic. Whereas Francan, I think Francan pumps very well. The fella came back.
CPR lah. CPR.
But this case, the one that I did with Adeline was very traumatic. Pump. The fella just don't come back.
He passed away in the hospital.
1 day later.
One day later.
So
that means Etern Medical really experienced in all kinds of even the emergency cases also. Some people think GP just give meds, take MC only, right? But we also do a lot of things.
It's definitely more than just the take MC kind of thing. Because I always wonder how come people keep coming back for certain ailments. Then sometimes you start to dig in and you realize that actually the person is more sick than you think.
So it's not that they come just to see you lah.
Sometimes it's psychological. Psychological. So they tend to over worry about their conditions. You have to address that as well. Things like that.
So when patients sometimes they keep coming back, do you think like they prefer about coming back to you? And sometimes, I mean, I work here, always set appointments, so sometimes they always say Dr. Lye only.
Because you listen to them, like you address, people felt that are being listened to. And majority of them do have issues, and it's not so-called mental issues.
Okay.
It's not mental issues. Majority have issues. They have medical issues and you must be old enough to have sickness that give you symptoms that don't go away one. Then you'll know how these people go through, because after for example, if you got toothache that lasts for more than 2 weeks, what do you think you will feel?
Stress. You cannot eat all this.
Depressed. You feel depressed because you have to cancel your buffet, your gathering, because your tooth is aching. You cannot eat properly. You start to have depression. You feel depressed. So likewise, if you got a chronic itch, if you have a flu that doesn't go away for 1 whole month, coughing, you got a headache or something, you got this eye infection that you cannot see properly for more than 2-3 weeks, the first thing is you will feel depressed. And then especially then when you feel depressed, not just depressed, but you are bothered by the symptoms. And then in the fast-paced GP setting, where efficiency is the first priority. Yeah, unfortunately.
Yes.
Yeah, so whoever listen to the patient will get the patient's attention. Yeah, and like what I say, the empathy comes when you experience this kind of stuff yourself. Then you will have that human to human empathy to slow down and then try to attune with the patients. And then the senior staff, they kind of like, they also have this empathy as they go along. Yeah, that's why they have their own following. You know, Francan and Adeline has their own fan base as well.
Long story short, he's the anti-killer.
The anti-killer.
I realize his patients are all amas. Around 60 years old, must
Not you, man. I thought
I also
you were
look for
anti-killer.
you for the blood test.
I
This
thought you
one
were
is
the anti-killer.
service. This one is the chatting one.
Service.
Oh.
The lip service.
Yeah.
You're the one. You also anti,
That
right?
one is the fingers.
Finger
Finger service. That one
The
trademark.
touchy one.
How about Adeline? What's your fan base?
Uncles.
Your fan base? How would you characterize your fan base?
The flower.
Actually, I think it's kids.
Pizza.
Yeah,
Oh.
I have more patient towards kids. Maybe because I have 3 kids myself.
I see.
Yeah. So during the consultation, here is one. During the consultation, if like the doctors need help in assisting, like hold the head or whatever, after that I'll play with the kid to gain back, the fear of seeing the doctor.
But how come every time I play with the kid, they will cry?
Because you're not cute.
So you heard it first over here.
Francan don't look cute.
No longer 80 also.
But I think it's interesting because of that, this if the staff stay long enough, people will see you beyond your basic jobs. Then you are a family of 3, you are experienced mother, things like that. Then you are uncle already, so you must have the 3
Multiple wives.
I'm not yet. If I have that,
Yeah,
I probably will attract that kind of patient. Like hypertension, cholesterol, fatty liver, things like that. So I'll probably have that empathy with those with hypertension, cholesterol, because as age catch up, I also have hypertension, cholesterol, things like that. So I like this. We are in the same boat kind of practice, because it's not like oncology. If let's say this is an oncology clinic,
Cancer.
I don't have cancer, so but the patient are all having cancer. So if you don't have cancer, the sympathy is there, but the empathy is not there.
No wonder so many patients find you for STD screening. You have experience in that. Right?
Don't have it. Don't have it. Well, I'm a guy.
But-
I'm a guy.
What a guy,
So I'm
that's
a
right.
guy. So the guys will come and see me.
So the last, just now you mentioned about depression, being stressed, right?
Yeah.
So actually, some people are actually scared of working in nursing or healthcare line because of that. Like just now you also mentioned nursing job is about fast pace and all this. Do you think, how is it like, you can tell our audience like how working Etern Medical, is it like so stressful? How is it like?
Stressful mainly probably accuracy.
Accuracy,
We really need to ensure that all medication we prescribe to the patients are all correct. Whatever the doctor type is correct, the dosing is correct, to prevent like complaints or overdosing. Other than that, I think our clinic is already very good because we are not just one staff working at the counter. We have a group of 2 to 3 staff, so we actually take care of each other during work.
Yeah, I think that's the major difference from other GP clinics.
Yeah.
They have more than one staff at the counter.
Yes, correct.
So how's the dynamic like, or like how's the communication like when it comes to working day to day and after?
We do
after
have a
session?
chat group, so we will check on the staff daily.
Using WhatsApp,
So, yeah, the WhatsApp chat group. So we update on our work. If the staff is sick, then we will also find cover in that chat. So I think not very stressful lah.
So how's the support system like?
I usually see my WhatsApp every day.
Every day.
I have the habit to check my WhatsApp whenever I have time. Yeah, so it's like a instant reply. Even like midnight, my staff says that, hey, I'm not well, I cannot
Give you a
come to
call.
work. Yeah, they call me and I still find cover for them.
Then what about personal? If you have personal issues, do they have this kind of like supervisor support for them?
I do staff engagement every Monday with my full-timers. Then part-timers, I also do staff engagement, but it's within my own time because some of them, they actually studying, so they only approach me when they are free.
Correct.
Yeah. So So we'll do some engagement sessions to know not just about work but about their family as well, their well-being.
I mean, I think just now you mentioned about empathy. I think because you have a family, that's why you also can talk to them about their family.
I think even doctors also, the doctors that do regular slots with us, I do catch up with them. Celebrate like Father's Day, Dr. Tang. I think you were there too. And their birthdays, I do send them birthdays eatings.
I think
so he's got a point. I mean, this is a good point because even though we know that healthcare, this service sector is clinic to patient, right? Patient need all the love and the care and the sympathy and the empathy, right?
Correct.
But then who cares for the caregiver? So actually, healthcare workers also need this caregiving. So I think being in the Asian valued society, especially in the technocratic society, right? Urban people are very, fast-paced. I think we are a little bit short of this personal touch. So Adeline comes in a very important role because of her temperament, right? One of the things about being a leader is leadership, right? Leadership is not the only thing that ensures success, but leadership is just one of the core skills in the upper echelon, right? Of course, there are subject expertise and strategic planning, that kind of thing, or PR, that kind of thing. But leadership itself is a useful skill, and she has it which can allows her to tend to the internal welfare of the healthcare workers, so that they can all get pumped up and then can better serve the patients. Right? I think this communication is important.
The people skill also.
Yeah. You need people
skills and the hard skills.
You need to have the heart to have the leadership. Yeah. So not everybody has this kind of attunement. Yeah. So
I feel like working here also, the management do create opportunities to have like career step up. They want to, some people who are able to be leaders. I think you're also set as role 1, session leads, even in charge of. That's why you have like CCs, clinic coordinators, who coordinate all the other different things and different clinics as well. I feel like this place really have so-called a structure where people can upgrade themselves also, right? And maybe you can tell them also like how is the engagement like. Maybe give an example of what do you ask them.
I think all the full-timers, they have their own portfolios, meaning they have their own things to take care of. Yeah, so mainly I will just check with them how is the portfolio going on. Yeah, any like things that they have not done or not done well or not done well. Whether is it any problems on any things that they need help in troubleshooting.
What happens if the portfolio is overwhelming for them?
That's why we have this engagement session to make sure that they are not overworked. And to ensure they are at the correct track to finish the whole thing.
Makes sense. I think it's like a two-way communication. I think some organizations, they just like top down, that's it, like I tell you to do, that's it, you got to do.
Actually, I think that what happens or perceived to have happened is because of the missing middle ground. Yeah, the middle ground, the CC, the C, the not substantial enough. Yeah, that's why it seems very top down. Yeah, and then I mean, speaking from the top, I mean, I'm supposed to be the top part.
Supposed to be.
Supposed to. No, small organization, right? But it's like when my experience from the top is that when you want to message down, you have to give time, because sometimes especially for very complicated tasks and projects, it just takes a lot of many messaging, and even after you message already, you have to write in words and in WhatsApp, in text, and then in small talk, and then you just have to give it time for the message and the projects to go permeate through because everybody always have many things to do every day. So in order to occupy their bandwidth is privileged. So you need a lot of patience, but sometimes we are a small enterprise, but in a bigger organization, sometimes there are so many layers. That's why the minister become very impatient, because I mean, even for my small organization, I find that I wait until I also
so many
get a bit
go through,
sometimes because there are a lot of interruptions and things can't get done. It's very frustrating. frustrating. And when we want to do things, some of the projects that we want has a longer lead time. You have to start the ball rolling because it takes some time to roll until you see the benefit, kind of things like so. Yeah, it's just that it can be quite frustrating from the top. Then the middle is to try to echo the message to the ground. Yeah, so this is a classic in corporate communication.
So one more thing, because one thing I noticed here from this organization, you actually have work group meetings,
yes,
and even annual group meetings, which actually partly is about strategy and all this. So maybe this question is directed to Dr. Lye as the boss. So how did this come about? Like, because a lot of clinics, I'm sure they work other places, they don't do this kind of this.
Yeah, you're right. So actually, I'm a doctor by training. I'm not a businessman by training. So when I started the business, right, then I thought, I better study and practice business, right? Then business is about meetings. Yeah. Then of course, as a layman, non-professional, our meetings is meant for communications. Yeah. So if you don't communicate, then how would the different audience, get the directions and all that stuff? So big meetings and small meetings, then different meeting has different purposes, right? Of course. This may not apply to sole proprietor, right? Where sometimes the owners wants to keep the certain information more private, right? But I kind of look at the other side of the spectrum, like at least the company, they are so-called very transparent. And then what is the risk and benefit of being transparent and non-transparent? Actually, being non-transparent, for example, reduces politics.
Yeah,
right? Because sometimes
people are hurt,
yeah, and then sometimes people don't quite understand the full picture, and then they prejudge and then they get upset, kind of stuff, right? But then when you give people a lot of information, the benefit is that kind of like people you earn trust, and then you might earn cooperation. Eventually, you will earn cooperation because those that do not cooperate will retreat. They will kind of like, this is not my vision. Like then I want a simpler cough and cold clinic.
That makes sense.
Yeah. I just want to do Panadol, Brufen. But in Etern Medical, we tend to be more up to the standard in terms of practice. Yeah, we always keep up with technology and changes in the practice in primary care.
All right.
We try to be the representative of the modernized primary care.
That's true.
Yeah, because of that, we tend to do things in a way lah. But this does not apply to other primary care lah. Other primary care sometimes they are simpler. That's why you see one staff at the counter suffice because they are all dispensing the same stuff.
Alright, so just now we were talking about having WGM, which is our work group meeting. That's how one of the ways that we over here at Etern Medical actually make some cohesiveness so that we have understanding and clarity. I think another thing that we also do is team bonding events, and besides the D&D, which is normal one, but we also have team bonding. So the last time, I think Seletar Mall site also did some buffet and barbecue, all this. Nice. So how do you find like all these things?
I mean, it's a good catch up and a good break for them. I think they all deserve something better.
Something better.
Yeah, so we are maybe planning something outdoors soon.
That's good. That's good. I can I interject? Because last time, long time ago, of course, by design and strategy, we want people to get together. So we have this thing called work group meeting, which is more work based, and then TB is the team building, right? Which is more fun based. Then initially, I was having some trouble trying to imagine what people like. So I was trying to be prescriptive. So buffet is the easiest lah.
Okay.
Right, but I think over the years, I let go. We let go. We let the ground decide. Then interestingly, there's some evolution. We got barbecue at the HG Void Deck. That was pretty fun. Very nice. The food is very nice. Then got USS.
The Punggol side. We also have USS.
I think the other side they are planning to go Desaro.
Desaro Farm also.
And then but this Fernview side, I think they are more physical. They like to go hiking or something like that.
Probably hiking.
Soon.
All need to 减肥lah.
Because they are in the steaming mode soon.
The Punggol side is more like fun. They like to have fun. Desaro, USS, Venture Farm, something like that. So the ground up GUI, ground up initiative is quite fun because and then we try to attach certain business objectives like whoever the first one to promote nebulizer service or
Crack egg.
crack egg. We got this crack egg thing lah. So whenever we have new things like LTSG, whoever get the highest enrollment, they get a certain incentive, and then they use the incentive as a group to finance the all this team building. I find it works quite well lah. It's a sustainable way of injecting quality life as a staff in Etern Medical. Yeah, it's sustainable. Yeah, because there's always there's a loop to it. Yeah. So far it works quite well. Yeah, I think the company has done well in this aspect.
One other thing also that management also does is the one-to-one appraisal. I think some people find clinic work right. It's just like, I just come here do work then go back like that. But I feel one over here we have one-to-one appraisal also. That one we can speak to our manager. They literally look into our KPIs also. We have performance bonuses. So I feel like this is a more dynamic role rather than like what most people think. Just working at the clinic, just that they give meds and go.
Actually, the appraisal is a good thing.
Why you say?
That means my bonus is coming. Means I'll
but how much? How much you asking for?
How much?
By the way, our boss is also watching our podcast.
Basically the KPI is mathematically linked to the profit and loss of your clinic unit.
I think the multiplier need to increase a bit.
Yes. If you perform better, then that kind of thing. That we moderate according to personal performance, your peer appraisal, how your supervisor, your peer appraise you, and then in multiples lah.
I feel it's good too because you incentivize actually your staff to work more. So if they want earn more bonus like him, then they will go out and do more.
Some staff are more not so ambitious in terms of.
So for this video, if you get 500 likes, our multiplier will work.
Yes. I mean,
we can have a marketing KPI.
That's the interesting thing about KPIs lah. Metrics are understandable on both sides. Yeah. Adeline, you want to contribute anything?
She just wants the bonus. Don't need to ask.
Want to mention anything?
I want to say about Francan.
Yeah. We got some tea.
There was one episode of him saving someone at Hai Di Lao.
Oh.
I think it's remarkable.
We're talking about bonus now.
Yeah, that's bonus as well.
You never tell your manager. You literally save somebody at Hai Di Lao.
Come say something about what happened that day.
Don't be shy. Suddenly you so shy. Maybe he's the guy choke on some fish ball or something like that. He's a man, right?
You kiss him?
I hugged him from behind.
Intimate.
He's quite a big guy or small guy?
Almost your size also.
He's a big guy. So Francan's small size, I big size. Wow, quite amazing.
But the guy was like legit choking, like something stuck inside.
Yeah, something stuck. And somebody else tried to help him in vain, right? Not successful. Then our Superman here, you know why? You guys know why he's so magical?
Yeah lah. You know why? His finger skills.
I know his trade secret. No, because Francan last time used to be a paramedic. And then not only that, I think he used the app, the SCDF, the app.
The first responder.
He go and respond volunteer himself.
Because I hugged many guys and girls of all shapes and sizes, so I got
experience hugging.
Yeah.
Oh my god.
How many boyfriends and girlfriends do you have?
Depends lah. Sometimes one.
Depends lah. One or two only. A birthday.
Only got one there.
But as long as you eat more than 4 times a month can already lah.
So did the Hai Di Lao guy? I heard they offer you lifetime membership, right?
No, so I think they give free food in discount.
Free food, right? Lifetime, right?
Yeah, and the patient also give like a red envelope, the ang pao, with the handwritten note.
I'm not interested in the lifetime membership. Does it come with like 2 or 3 friends? The lifetime membership is plus 1 friends.
Yeah, I think so.
No, lifetime, right?
I give you an off day.
Never invite us.
So for context, actually Hai Di Lao is just a few units away from our Seletar Mall outlet. That's why they approached us. Actually, I noticed that Etern Medical in Seletar Mall happens to be the emergency department of the whole mall also.
Yeah, we got a lot of such cases.
They always come to us.
People fall down from escalator, all kind of serious.
Correct. Yeah. So I think that's the benefit lah. Not say like benefit, but we do get those small gifts that we get, and I think that's actually what we feel like appreciate. We don't even need gifts, but just people like giving us a even handwritten thank you note, right? That one means even a lot more to us. Especially as healthcare workers, just now Dr. Lye say, a lot of people like undermine or like see us just as a customer service. That's it. Like, faster give me my MC. I want to go already. Yeah, but these kind of small things, actually, I feel like
real
heartwarming for us.
Real, yeah. I mean, speaking from somebody that's been around for 20 plus years, right, as a GP, right? When I was a junior GP, things are very theoretical, but after doing this job for 20 years, I realized that things are real, and then because of the recognition that is real, I kind of like collectively we make it even more real. So, for example, this research being real, it really happened, and it happens quite often. 1 year, one time or 2 times, and because of that, we take our BCLS, basic cardiac life support, a lot more enthusiastically, and we do our equipping, our staff readiness in terms of training quite proactively, because I think amongst us, because we share the stories, so I think our staff do not complain that we need to go for BCLS again, because they know that
actually can
they
be
know
used,
it's real, it will happen
useful,
to them, and then I like that reality thing, so whatever we do is real, and because of that faith, we dare to invest even more in terms of time and resources.
Actually, so we got one of example over here. So Francan, you remember this?
Oh yeah,
so maybe later our editor can put on top for you all to see. Basically, this one is a handwritten note. One of the one that Francan got. Is it the Hai Di Lao one?
Yes. Yeah, the Hai Di Lao.
Yeah, that's the Hai Di Lao one. So for us, we see like all these small notes. So maybe, and you can send it to us also lah. Actually, we like to read all these, especially if you send it on our Google review.
You asking for compliments, right?
Not asking lah. If we deserve it, you send it to our Google review. All our
it helps us a lot.
Release
It helps us a lot. Yeah.
Sidetrack. He didn't take all the money, but he shared with his teammates.
See, that's why he's the best master phlebotomist, master medic, and why all the ama and akongs all find him lah.
Some boot liquor number 1.
So I think really lah, Etern Medical have completely different experience from working in other GP clinics lah. Okay, so now we have something fun. Talking about just now fun activities that we're doing, we have something fun to do, which our producers have prepared. We have a game section that we just introduced. This game, okay, take one. Dr. Lye, you don't need that one. Because why?
Oh, it's about me, is it? Oh,
yes. Okay. So the
how many girlfriends do I have?
no, how many girlfriends? Not a quiz.
I tell you the answer too. Okay.
So recently, I think it's in our pilot, Dr. Lye got mentioned that he does painting. So what we're gonna do is we're gonna show you some of Dr. Lye's painting, and then you guys have to guess. Actually, me too have to guess what Dr. Lye is trying to paint.
He's not writing that enough already. Still want to see his drawing.
Exactly, that's the challenge.
Prize money or not?
If you guess correctly, you give us some points.
So, suddenly everyone kepo. Everyone in the office suddenly want to see. Okay, so you guys can write like maybe about one phrase or few words to see what to try and guess what Dr. Lye is trying to portray in his painting.
This one he paint one, man.
So you can write. All this is Dr. Lye paint.
Compared to his handwriting, this one very nice.
So maybe he should paint more.
A phrase.
Okay.
Yeah, I always paint with meaning, because I'm not a good painter. So I always try to put in some meaning so that it can remind me of the values that I hold in my heart.
Have you ever thought of changing your job? Go and become pastor or something?
Good question.
Good question. Yeah, a bit too late lah. A bit too late. I'm one leg in the grave already.
No copy lah.
I also know. Just copy what I
This one quite deep. Yeah, good
deep.
choice.
Oh.
Yeah. So whoever can get the
meaning.
Yeah. Francan, very concentrating already.
Yeah.
I can sense your anxiety. Suddenly not sleeping already. Why you want to be the top scorer?
I feel like my answer too simple already. I wrote too fast.
对嘛 it's just show and tell 的 this one.
Painting is subjective, so it should stir up the viewers' response lah. So as long as it can stir you up, I think it has achieved one of those interesting thing about a painting. And a good painting is one that, in my opinion, can stir up a lot of thinking and feeling. Right. In order to do that, the painter must design as such. Right. And the fun thing about painting is that.
Too deep for me.
As you paint along and ideas and feeling comes, you use your brush and your color to go with the thinking and the feeling. Yeah.
Okay.
You all don't understand what I'm saying.
So later after we show you our answer,
and
maybe you
feeling,
can link to us.
using brush and colors, right, to go with your thinking and your feeling while you're painting.
Okay. I think Francan a bit excited to show the answer.
Francan.
You're a bit long, just now.
Don't know whether maybe Francan got potential. Okay, well, I'll call it Tuti.
Oh my god.
I think Dr. Lye, before Dr. Lye explain, Dr. Lye can actually choose which one is the closest one to what he actually tried to manifest.
Okay.
Get
point lah.
show me.
Points ma.
Okay.
Wow.
So maybe Francan, you can read out your answer
What my one
first.
first? You read out your
You
one
excited?
word. You read out your one word answer first.
He's very defensive. This guy very nervous. What?
I can't see it.
What's that?
You just copy the painting.
Yeah, I mean, I wrote this before he said it was deep, so I thought it was just ambition.
This is what you call a man with no ambition.
A bit too far. Yeah, my answer is just ambition. Because that's what is on the picture.
Okay.
Yes.
It's okay. Okay. How about you? Our friend
I think you read yourself.
Most
See
interesting.
whether tally or not. Should be
must have high ambitions, aim high and far, no matter which position you are currently at. Wow, pastor.
Because they are standing too far
Can
away.
show to the
Okay.
camera.
Yeah, show the camera.
Wow, this one what's yeah? Graph
Okay, what about Adder?
You read lah.
Bottom looks like fire, hell, correct.
Ooh.
Yeah, versus heaven. Why go heaven after I do so much for people? Wow! Wow! Mission. Okay. So I think Adeline got the best answers. Okay, so this one is the interpretation from the painter.
Okay, logic.
Yes.
So you notice that the word ambition is like a snowy melting snow.
Like mountain.
Yeah, and then as it melts, all the water comes down at the water level. Right? See, so it's like trying to portray that ambition takes time to grow and warm up and defrost and one says I like this phrase, life begins at 40. So for younger people,
You all begin already.
yeah, mine has defrosted already. So for the first 40 years of my life, I wasn't very sure about my ambition. But after 40 years, I roughly know what I'm good at, what I like to do, and where I'm aiming for, what I can reasonably achieve. Right. So everything is very finite, and then off I go. So I like that melting ice kind of concepts, right? Yeah. So that's what it means lah.
Okay, thank you Dr. Lye for the deep insight. I didn't expect that also. Okay, maybe you can see the next one.
I actually drew this for my son's 14 or 15-year-old birthday.
Ooh, okay.
哇，这是什么来的？
哦，
鱼缸啊
No lah, this one 你 flush tolerable 啦，那个大便来的。
Good, fantastic.
？LED 啊，
Yeah. Wow, fantastic. Francan is quite talented. You must look close up, then you'll see better.
大便哦。
Yes, correct.
What you eat is what you shit.
Yes, correct. Can you give 5 examples? What are the food type that generate the 5 different kind of poop?
大便呢？
Actually, this one, if you look under the light, it will have sprinkles. Very nice.
Okay, you guys got 10 seconds left.
Okay.
Okay, maybe start with Adeline first.
Yeah.
Can you explain?
How deep is the well? I feel like it is in a circular motion, and from what I see from top, it's like there's something very deep in.
Washing machine, maybe? With soap. Washing with machine. with soap. With soap. Yes, I think it's good. This is like Marthius just now the ambition one. A bit better. Yeah, a bit better. Okay, next. Don't worry, I'll be the one that gets scolded by you.
Why? I don't know. I see like
tornado.
it's like top-down view of a tornado. So it's like swirling. So it's just a bunch of confusion.
I like the last word, confused.
Not Confucius. Confused only.
I like the word confused because that's what this picture is stimulating the viewer to generate. Yeah. So that's the cognitive part that I like the viewer to generate lah. Okay. Francan.
So it's the picture of a stool going down the toilet bowl.
Yes. So this one
is why you shit.
Okay,
then the importance of gut health.
This one is the equivalent to Adeline Cole's answer. So literally that's the literal translation. That's the cognitive translation.
So who got the point?
Oh, the final answer is I haven't named the picture yet. Yeah. So, that's why you see the picture looks a bit empty because.
So you draw halfway.
It's not done. Is it?
Yeah. When I draw, sometimes just based on the brush and then it becomes like that. Then after that I kind of run out of energy. I couldn't
So
push
whatever answers we give, then you take the idea, then you go and
maybe confused. Confused.
So it's a two-way now. So adding on to the painting.
Yes.
So no winner here.
Yes.
Tie.
Yeah, tie.
Is it tie? Okay.
Maybe Marthius get a point lah. Yeah.
Wow.
I'll
Okay.
give Marthius 1 point.
Capture the cognitive part.
Thanks. I'm good point.
Alright.
So you all know how the marking scheme is. Must be something cerebral one. Literal, okay, you get 1 point. Cognitive, you get 5 points.
Okay.
This one. I
15 minutes.
Yeah. Because I told you I'm not a good painter,
Okay.
but I like the idea, so I kept.
Is the meaning
Yes.
more than
Yeah. I like the meaning. That's why I kept the picture. Okay, this one the answer is written there. The cognitive answer is written there. So the answer that I expect you guys to give me is the literal feeling, the literal translation. How does it look to you literally? Because if you can imagine, you can translate your imagination to something that you see day to day kind of thing.
Yeah, 5 more seconds.
So is that
5, 4,
Day to day.
3, 2, 1.
okay? Come, Adeline first. Okay, looks like running track from
A point
point
to
A
another
to point B. Yeah, not bad. I can give you a point for that. Yeah, you get 1 point. Yes. Okay, our dear friend here. Imagination. Imagine how little things can affect how things turn out. Wow, this one is more cognitive one. Imagine how little things. Yeah, not bad. I can give you points for that. Yeah.
This one's zero.
Not bad. Wow, freedom. I like the word freedom.
flow? You look like you're incontinent. You know?
Wow.
Like,
Okay. Not bad. I mean yeah. I like the word freedom. I'll give you 1 word for the 1 point for the freedom.
1 point.
Yeah, urine incontinence is the fun part of it. Yeah. Okay, so this one, can y'all see the people snorkeling in the water?
Wait a minute.
Then there are all the bubbles. How many people are there? How many people are snorkeling in the water?
2 or 3.
3, 4.
Each line is 1 person.
No.
Like Avatar like that, it looks like, I imagine it's like Avatar, people swimming in the water.
Now I imagine all the dots are the butt.
5
Those are the little bubbles.
Is it 5?
Yeah, about 1 big one, 1 distant one, and then
So each line lah.
This one also look like human.
Yeah, so it looks like people snorkeling in water. Yeah, which is Adeline is the closest to it in a sense.
Running from A
Yeah,
point A
yeah,
to point B.
yeah.
Oh, that makes sense.
So there's no wrong or right, but it's quite fun, right, to look at things, right, and then everybody come up with little ideas here and there. So I find so in a sense this is a successful picture because it can generate different kind of thinking and feeling lah. Right? But can you imagine that you are in the water snorkeling?
I mean, after explanation,
freedom,
it makes
the
sense.
word freedom, yeah. So I like the word freedom. You feel free, right? When you look at this picture.
Inside the water, so you feel
like let's say you're on leave, then you go Maldives, and then you're snorkeling, and then you feel free. You're on leave.
3 points.
Okay.
Yeah.
Okay, 30 seconds now.
Oh, I think I know this one.
This one is very difficult for me. I paint until I'm flat out. Yeah.
Wait. Okay.
Okay, pen down.
Okay, who wants to start first?
Me.
Me.
I
Okay.
think this one quite deep.
Fear of the
So,
unknown.
fear of the unknown.
Loneliness.
Yes.
As a pioneer leadership tracking. Not bad, not bad. Leadership tracking, like army in the
Because it looks like
rainforest.
it's in the jungle.
Yes,
then,
yes,
like,
yes.
Because you say YOLO there, so it's like maybe it's fear, so you just need to whack. Just go ahead.
I have 1 point for leadership and tracking because when I was painting this, I imagine during my army days, I was an infantry so it's damn tough, Then forever, that kind of feeling. Yeah. Okay.
Because this one suddenly got a
Francan.
dark mood to it.
YOLO. The grass forest is big, green, many opportunities. Do whatever you want. Yes. Yeah, you only live once, right? So even though I was in the forest suffering, but I look back, it was actually quite fun. So it was both fun and painful.
Okay.
And that was one part of my life. Okay, how about Adeline?
First time Edo so short.
Deep thoughts.
Deep
Deep thoughts.
So
They
deep.
look quite deep in the
Okay,
forest.
I see.
Yeah, so I feel like it's trying to look for some directions and what's ahead over there.
Okay. Not bad. Okay, good. So I give you 1 point for that as well.
Yay! 4
Does
points.
Francan get a point?
You got point or not?
Okay, you get 1 point also.
Wow, I will get a point.
Yeah. Like what I say, if that picture can generate thoughts and feeling, which is not directly, I think it is a success already.
Alright.
Okay, so this
Is that
is the very last one.
Oh, okay.
Yeah.
Wow, okay. 你的花.
Oh, wow, this one.
Like, you just 10 more seconds to think about it first before I start my timer. Okay, timer starts now. 10 more seconds. 3.
Okay, this one don't squeeze too hard. This one is just a nice painting.
Just nice painting. Wow. We are primed to do so deep suddenly.
Because they are unfair to you guys. So I see. Forbidden love.
Got We Love Etern there. Cause I don't know, over here is
We love Etern.
WLE.
Hey, clever. Okay, I didn't know that also.
WLE in your painting.
Later, wise mind, logical mind, and emotional mind. This model apparently is a psychological classic where whenever your brain is tickled, you have to ask yourself, are you using your emotional mind, logical mind, or wise mind? For example, somebody is not nice to you, then you tend to be very calculative, right? Logical. Or how should I get back at that person? You cheat me $10, I want to cheat you $10 back. In fact, I'll cheat you another $1 back. So that's the logical mind plus a bit of emotional mind. But how about the wise mind? Wise mind is that, is this battle worth my effort to fight? So do I have better things to do? That's the wise mind. So it's a psychological classic. Yeah, when do you want to press which button, and then have you checked all your faculties, so to speak? Francan, what's your imagining flowers for one of Dr. Lye's many girlfriends?
Yeah, because he got a lot of flowers.
Not too bad. I think. Yeah. Okay. But no points for that. Blooming from seeds. Blooming. This is nice. I like this
I
one.
see WLE and V live in Etern.
Wow.
It's actually start blooming from seeds to become a flower.
Wow, 10 points. Yeah, I didn't thought about that. But it looks it's quite very cognizant. Very cognizant. Yeah, multi-layers. Fantastic.
Guys.
I like multi-layers interpretation. This is very multi-layer. Aesthetically congruent, right? Pictorially congruent. There's a difference. It looks nice, and she described the aesthetic part, and then pictorially, the flower dripping, the blooming seeds down, right? And then the meaning also is congruent, right? So multi-layer interpretation, and everything gels. So the interpretation is beautiful.
Wow, that's true. Actually, that's perfect. Yeah.
Maybe I should rename the picture as blooming from seeds.
Oh.
We love Etern. Yeah, very good, fantastic.
Wow.
Okay. Learn
So I got
something
10
from
points.
you. Yeah, 10 points.
10 points. I think this straight away Adeline wins. Adeline wins already. Wow, okay. This is interesting. So I think you all also got a peek into Dr. Lye's mind. Very philosophical, metaphorical, and even aesthetically pleasing, to be honest.
Actually, just to share with you guys, right? I'm from gurus, right? It says that in order to, philosophy. I mean, these are philosophy and psychology. The prowess of philosophy and psychology, or knowing and not knowing, the importance of it, right, is that you are able to better design your life and your community. if you have a better philosophy and psychology backing. Yeah, because it does permeate through whatever you do and think, right?
So you say philosophy is how you lead your life,
Yes.
even as in the work life?
Yes, because 24/7, how do you think we handle that, right? Last time when I was a young man, I don't have such grounding, so I would be thinking 8 to 5, what time am I leaving and stuff. But you know, when I left at 5 o'clock, something like that, then I go home. What do? I also do nothing. Watch TV and something that's quite meaningless one. Yeah, so it's like when I become more experienced, then I realized that, for example, one of those things that I keep telling you guys is that your work life is a big chunk of your life. You know, you shouldn't detest your work life, because no matter how you run away, your work life will still be with you. So you might as well make your work life your life. You cannot run away from your work life, because your work life is your life. So you must make your work life very fruitful, and then your life will become very fruitful. And then in that sense, when that happens, then I realized that 1 week, 7 days, if I work every day, I don't feel the pain at all, because I do enjoy what I do. And that's quite beautiful. I mean, money aside, I'm not sure whether being paid or nothing like, but I think just from the philosophical point of view, I think it's philosophically correct.
I think this is similar what you're trying to refer to, like Ikigai lah.
Correct. Ikigai, Ikigai. This is our philosophy as well. Ikigai is a philosophy. So if you are not grounded in philosophy, you'll find that your action and thinking tend to be handicapped. Greatly handicapped, as I was when I was young.
So we see a lot from your, we pick on your brain just now with all the painting. So maybe we can ask you, what is your dream for Etern, and what are the next few steps that you see for Etern, and relating to that, what kind of people that you're looking to hire next?
Utopia. I mean, my ambition is both modest yet ambitious. Modest in the sense that I'm just a member of the community with no fantastic linkage, but I do have I do enjoy what I do, right? And it's good to share this excitement with like-minded people, right? Like-minded people that enjoys service sector, enjoys primary care. Primary care is not so morbid, not like hospital care. Hospital care patients tend to be very sick, whereas primary care, the enjoyment is like obesity, diabetes, hypertension, cholesterol, cough and cold that never go away, that kind of stuff. I find that this entails a lot of interactions with the patient. I enjoy that, health screening, things like that. So I enjoy this journey, and technology keep turning, so we can always adapt new technology and enhance people's health. And I can learn from my patient, because we are the same boat, just like the oncology conversation just now. So I find there's no better things to do I can do but other than this. So modest yet ambitious. Whoever there is keen learners, they will stay with Etern Medical. You can even be a non-medical, come in and contribute. I mean, we have a HQ that does social media, that is doing a fantastic job, right?
Behind
because it helps us to communicate to the public, and then let us healthcare workers express ourselves to the public. Because I think GP is quite one of the misunderstood industry, because people always have this stereotype. So I think even non-nurse kind of background can join it.
As long as you have the willingness to learn,
the industry
able to learn, and it doesn't matter where they come from.
Sometimes I tell that we are in a treasure hunt ship. Wherever we sail, we'll just enjoy the journey and grow together
Just take example from us also. We're all from different backgrounds. I got my schooling background. I'm still studying right now, uni. But then Ada come in, no clinical background, come in, train up auto-K, become senior staff. And Francan straight away come in, some super chai, like medic come in, then come in with all his flebo skills straight away. We're all really from different background In Etern Medical, we don't discriminate like that. Because we really can train up from bottom up. I think Dr Lye also, one of Dr Lye background is also from lecturing, right? And training, if I'm not wrong, in the...
That's Dr Lam.
Dr Lam. Basically one of our other senior doctors.
You don't know your bosses well.
Minus
pay.
You multiply.
It's okay. Is that one of the point philosophically? Cross path. Our path cross once upon a time. So sometimes we have good staff, great staff that stay with us for a few years and then they move on as they grow.
Stay for a few years, still don't know the bosses.
Then, you know, so come and go kind of thing. So it's good that as long as you come here, you contribute, make everybody happy. When it's time to go, I suppose it's time to go, but just make sure that everybody have a good time together, keep it positive. We like to keep the company environment positive, right? Of course, we wish to expand, right? If we have good value proposition to the community, I think we have.
I believe we do.
I think we have, one of the earliest investment that we did is HR. We always think healthcare service is about healthcare worker, right? If we can invest enough in terms of time and resources and attention and sweat and blood in the healthcare worker, we have all the system that you mentioned just now. I think the people will grow, and then that will translate to customers' experience. I think the hard and the soft we do have quite a bit. Right, so of course, it would be fantastic if we can really bump it out and then show the world,
Definitely
something precious. But I think it's up to the world to recognize us, in that sense.
True.
In terms of demand and things like that. I mean, of course, there's some strategic things that we need to invest further.
How about you, Adam? If you have the say to hire the next Etern Medical staff, who are you looking for? I mean, you work closely with the staff, so.
I mean, anyone can come in, because everyone has their good strength and weakness. We can always work on their strength, when they come in to work.
So no preference lah.
I think the attitude is more important than the attitude. I mean, attitude need to have a bit, but
Francan?
attitude is the go far.
For me, as long as Chobu can already.
But that one up to the boss lah. That one we have no say.
Okay. I think young people so.
But so I think we have another short break before we end off with our last topic. Okay, let's stay tuned. Okay guys, welcome back. Suddenly we got one extra person. That's because we are having a new topic called influenza. So influenza is actually a very misunderstood thing by people in general public, I think. And usually what I see as working at the counter also, people will always come here and say, I got the flu. What symptoms you have? I got flu. Then typically more often than not, they're just referring to runny nose. Correct?
Correct.
Yeah, but actually maybe the flu that what we do here is actually we do a test. So maybe Dr. Lye, you can share more what exactly is the flu and what is the test about?
Okay, so I when I was a junior GP, I used to thought influenza, just like any kind of virus and kind of thing. But over the years, using this flu test kit, give us a lot more ability to profile what influenza and what is not influenza, right? So the peculiar thing that I noticed about especially influenza A is that this kind of patient, they tend to have tachycardia very early in the presentation. Tachycardia.
Maybe for
heartbeat very fast. So 100, 110, 120 easily. Day 1, day 2. Now I was thinking, initially I thought it's just random coincidence, but after a while I kind of link up the logic because we know influenza is one of the well-known that causes myocarditis. Point number 1, heart inflammation, heart muscle inflammation. Then influenza patient also reports early in the presentation muscle ache. Right, myositis or skeletal muscle inflammation. In fact, there was once I saw a lady presented with bicep swelling, very big. Bicep isolated myositis. So I could link up all the logic. Basically, the virus seems to have these predilections to muscle cells, and then when it infects your heart muscle become weak. That's why he has to pump. His efficiency drops. That's why he need to raise up just to sustain basic cardiac output, right? And the patient usually inevitably will complain about tiredness. They look tired, they complain of tiredness, right? At extreme, of course, they will have decreased effort tolerance, all about tiredness because the heart is weakened. Clinically, you detect it by tachycardia, right? And then, of course, the other side, the skeletal muscle being muscle ache. So they will be telling you aches and pain. Very early in the disease. Day 1, day 2, they will tell you. So these are the telltale signs. And the interesting thing is that there's not much of nasal or throat complaint. comparatively.
Oh.
Yeah, interesting. It's very interesting. Like rhinovirus is about running nose, RSV virus is about bronchitis, bronchial symptoms. But influenza syndrome is a lot of muscle aches, a lot of tiredness, tachycardia. So these are the clues that I use to call for a swab lah. But of course, a lot of time on the ground, patient or staff will use fever as the
Fever.
cue to do a swab.
So fever is usually 38.5 and
So a lot of time, people don't like their nose being poked, right? So they only accept when they think that they are seriously sick lah. So 39 degrees, things like that. But can influenza happen at a lower temperature? Obviously, theoretically, the answer is yes, right? That milder population, probably half of them don't show up in the clinic. They DIY themselves, all right?
Oh.
Unless they want MCs, right?
Correct.
Sometimes they just carry on, pop some Panadol and they just move on. The population that we get to see and get to prove that is there is those that are more severe one, right?
So how many, maybe since you have done a lot of swab also, I think Gowi here, which is actually our producer behind the scenes. So yeah, you guys also do a lot of swabs, right? So actually, is it common to have like no fever or no symptoms and suddenly have influenza?
I do see patients with symptoms and they actually chat with me during triage. They do say that they have this very bad severe body ache, like kena bang by lorry, that type of effect. And then severe headaches.
So like body ache like that.
Headache, the neck muscles,
Neck muscles. So
scalp muscles.
we do advise them, if you want, we can actually do a swab for you. And some do came out as a positive A.
So what kind of swabs actually do we have for them?
We have the 4-in-1, which is the flu A, flu B with COVID. And we also have the 5-in-1 swab test, which is the adenovirus, RSV, flu A, flu B, and COVID. Yeah.
So would you recommend, like if people are unsure, just do the test? Is it okay to do the
Ideally,
test?
if affordable, if they are keen to come out from the pocket, yes, of course they will do lah.
Is it like some people don't know, like is influenza actually like severe, or like does it actually something I can just now you say just go home remedy like that?
I presume people are very conscious and wise in terms of their decision making, but the most obvious sign is when they are very sick, 39, they are breathless and all that stuff. Something not so conscious one is if they have young kids and elderly at home. Sometimes they are not the very sick one, but they are the one who pass the virus to the vulnerable ones at home. Yeah. So and then of course the practical ones, like for example, people are traveling, then they come out with all this kind of thing, and then they want to really wrap up the illness before they travel. They will ask for more proactive strategies lah. Then the swab, of course, is a more proactive strategy to get things expedited. Yeah.
Right. Because there's this recent case, probably only about 1 year ago, there's actually somebody a famous person which we won't mention, that actually passed away due to influenza. So is that like a common thing, and how maybe in like Singapore context does that happen?
People die from influenza. I think there are some statistics that shows that influenza, RSV, even COVID is still common entry to the ICU. So it's real.
And so if you have influenza,
especially the vulnerable ones.
So vulnerable ones, example like
elderly, more than 65, less than 6 years old. Then people with chronic diseases like obesity, bronchitis, diabetes.
So with chronic diseases,
people with weak lungs, weak heart, even weak kidney. Kidney impairment, people are immunocompromised. Then people who are taking like all sorts of funny medicine like steroid for lupus medicine. Nowadays, even eczema patients, psoriasis patients are taking biologic things like that. They live better, they live longer because of the special medicine, but because of that they are immunocompromised as well.
Okay.
It's becoming more heterogeneous. Last time it just transplant patient, but now got some chronic disease patient. Many kind of chronic disease patient that they are using very special medicine which may compromise their immunity lah. So that population is like for example kidney patients, their survival is getting better. So we have a lot of kidney patients going around. Yeah, but I think maybe we don't realize that they are actually immunocompromised. I don't think people are kind of like that, treat the consequence that seriously.
So this people, if they are infected by influenza, they can be treated.
Definitely, the Tamiflu is a very
Tamiflu.
safe and very
So
effective
for our
medicine.
orders out there, what is Tamiflu and what does it do?
It's an antiviral medicine, very old. It's been around for like 20-30 years. Even for children, they can take. Not much side effect. Very little side effect. Unless the person has a history of vertigo,
Vertigo.
prone to giddiness. Some of them can complain of worsening of their giddiness, but the rest are very safe. Last time you can read the black box. There are all these children go suicide, all those things, hallucination. It doesn't. No, not really. On the ground, it doesn't happen. So not much of allergy. Haven't seen any allergy before as well.
So it's safe for most people to use lah.
Yeah.
I mean, after all, flu is also quite common. The influenza, not the common flu. Oh yeah, by the way, common flu, influenza, is it the same thing?
Influenza, I think, is more specific. Flu, I think. Another point I don't make is this. Sometimes they say Tamiflu is indicated before 72 hours. There's this phrase in the description, but I always tell patients, that today you see me day 4, if you are 41 degrees, what do you think I should do for you? Should I not give you Tamiflu? Let's say the Marthius, your Goey, you are seeing me for day 4 or day 5, maybe day 5 lah. Day 5, you come, I swab, you are positive, and you are 41 degrees. Do you think I should give you Tamiflu or not?
That's a good question because our friend Goey here, he himself had actually had influenza before. So maybe you can answer Dr. Lye and maybe share your experience also.
For me, I don't exactly remember, but for me, it's also quite similar. I think for me, it's like day 4 or day 5 already actually, but I thought it's COVID all along. I never really bothered for almost a week. Then I also was prescribed Tamiflu in the end eventually.
You wouldn't, because there's this phrase, there's some people remember it must be taken within 72 hours or else or else what?
Some doctors also don't want to prescribe.
Because of this phrase, because but I think that phrase is a little bit one-sided lah. Because I think we should try to exercise our common sense. Of course, day 4, day 5, you're on the path to recovery. You feel better, right? You can don't take 1.1. But if there are variations to this scenario, for example, if you got vulnerable people in your house, right? Should you want to wrap it up with reduce your viral load further rather than let it dangle around, right? Point number 2 is that if you're 42 degrees, you're not exactly getting better. Right? Influenza can get worse on
Can it be more than 1 week?
Yes, of course. I've seen there's this teenage girl, 42 degrees, and then after spontaneous recovery, after I think 10 days, she got another bout of 42 degrees like 1 month later. It's complicated already. Hers is complicated. It went somewhere, somewhere it's really macerated and she's run into complication. It's complicated already. So the thing is, I think as much as what the government trying to discourage excessive use of all these things on the ground, when you are sick, we cannot be so simplistic. We still have to exercise our judgment because there are bad things that can happen, right? And I don't think erring to the safer side is bad. It's a bad. I think it's a good idea unless you are just being excessive, right?
So maybe you can tell us do you take the Tamiflu or not?
I took. I finished everything, and then funny thing is for me, most people will say like 4 to 5 days, right? You tend to get better. But actually, funny for me is I really got worse. In that moment of time, I'm like, wow, lying on the bed, really, dying there, really cannot move on. It's like my headache is like really someone just constantly punching me every 5 seconds. So I think the Tamiflu part, like the 72 hours, for me personally, is like tested and verified. I'm still here, so no problem. I think it's really okay.
No side effects.
Not
like lingering effects.
Actually, I don't know.
Okay. This is there's another subtle point here. That down here, the parallel is example. So I got some bacteria rhinitis. Give me my antibiotic. I take already. It should work, right? But how come I still feel miserable? You must have the other parts of your self-care must be there lah. Are you hydrated? Are you resting? Are you well nourished? Things like that. So actually, even though we are talking about Tamiflu, antibiotics or something like that, it's just one part of the puzzle, right? There are other parts of the puzzle that you need to check box as well, right? That if you can't get it right, you may not do as well. I mean, for example, I got a patient after 2 days of resting, go for jogging, and then came back after the jogging. The next day, 40 degrees again. I mean, you trace back the history. Friday finished the sickness. I don't know. Friday saw doctor. Saturday, Sunday recover. Monday go and jog. Then Monday night come 40 degrees again. Why? If I tell you like that, you know why, right? Because he didn't rest, man. He kind of pumped his resources.
So rest is important also lah for people recovering.
Yes. So therein lies the need to be reminded of, maybe.
So if you get
maybe sometimes you need a doctor or
influenza,
something.
normally how many MC would you give?
Good question. As a healthcare giver, the more is always better, right? Point number one, in principle, the more the better, until you feel that you have enough as a patient, right?
Is it possible to get 3 days, one shot?
Yes. I mean, if you are 42 degrees, that's really something serious. I think you better take a longer break, things like that, right? Yeah. Let's say you work from home.
Yeah.
That's an intermediate solution. If you are a white collar worker, if you have a work from home privilege, you can continue to work at home. Yeah, because I think that's a good intermediate. Because sometimes people still want to work because of responsibilities. And then if you have this work from home kind of facility, you can actually choose to work from home. Yeah. If you talk about turnaround time for healing wise, I think actually after 2 to 3 days of rest, most of the people are about 70 to 80% recovered. But there are still like 1/4 not well lah. So that 1/4 not well, depends on what you do long, right? Like if you work at Tuas, then you take public transport, I think it's very tiring, and then you work like 16 hours at Tuas, climbing up and down. I don't think you'll do well. I think you'll get a relapse
So is
or
it
complication.
possible to prevent yourself from flu?
Healthy lifestyle.
Healthy lifestyle.
That's the general statement. But I have some I quite local therapy techniques. Saline spray, the nasal throat,
that you always give.
on my all the throat spray. But the way I tell patients is I try to cover every inch of the ENT, not just spray 1 or 2. Yeah.
What about immunization?
Immunization.
I think a lot of people also probably heard about flu vaccine besides the COVID one. I think but some people don't know whether they need to take a lot or once, twice. How does the dosage?
So clearly, it's definitely for people with vulnerable people, right? Vulnerable people more than 65, less than 6, chronic disease. Then the second group is people who stay with vulnerable people. First group is vulnerable people. Second group is people who stay with vulnerable people.
Also to protect them.
Interval. Vulnerable people should be taking every year.
Every year.
Yeah. Then people who stay with vulnerable people preferably have a yearly vaccination. Then if you are none of the above, my general recommendation is every 3 years.
Every 3 years.
Yeah.
What about
But people tend to come in, they treat it like a travel travel
I was
vaccine.
going to ask that.
Which after a while I tend to realize that it's legit because one of the high risk behavior is traveling, because you are subjected to crowding in an enclosed space in a prolonged period, like aircraft cabin, the tour bus. These are actually the cause of transmission.
It's similar to COVID in that
Yes.
sense. You need social distancing also.
Yes.
For influenza. Okay, there's one more commonly asked question. Do you certain countries have more prone to influenza? Like for example, the last incident was Japan.
If you look at the next coming vaccination, influenza vaccine, the substrain, right?
Yeah.
Did you know I read to you the Southern Hemisphere 2026, right? There are 2 A strain and 1 B, right? One of the A strain is Singapore.
Singapore?
So Singapore is a very cosmopolitan country.
So that means
We are a place of exchange.
we produce
Yeah. Yeah.
Oh,
We are the
mutated
place
from
where people come and then we get
That's
mutations.
surprising, guys.
I make this observation, like for example, we host what was it? Taylor Swift. Taylor Swift. They came, then there's a surge of infection. F1, there's a surge of infection. So mice all the meeting and the thing, then we get a surge. And then every time Singapore have holidays, we have a surge as well, because we have a lot of foreign talents, from China, from India. They go back and then they come back. Yeah, they take turns to come.
You are the port lah.
Yeah, then you see there's
Cover
a
everything.
surge. Yeah. So Singapore indeed is a melting pot. Yeah.
Does it matter like which strain, which hemisphere, all this? I think Ada always order vaccine all this. So like, does it matter like what strain or quadrivalent, trivalent, all this that we have?
Actually, not really.
For flu
So long
vaccine.
as you do your vaccine yearly, you should have be well protected.
So exactly like what Dr Lye said, yearly is enough.
Unless you're the vulnerable group, then you have to chase the latest. Yeah, I think for normal people it's
Singapore
a bit complicated to chase the little substrain, because sometimes they change, sometimes they don't change. Like for example, this time they seem to take away the influenza B, become trivalent, because they think that it was a bit repetitive. The Yamagata lineage has been around. The Yamagata Phuket has been around for the longest time, and then they decided to take it out because maybe it's unnecessary, because all the previous versions have poke all the time. Yeah.
So basically immune already lah.
I suppose so.
The last question would be, Dr. Lye, your last Japan trip. I think because of the Sakura season, and how was your last Japan trip? Did you contract any influenza? Did you get any MC for it?
No, I didn't. I didn't. It wasn't.
Is it because you take vaccine?
Yeah, I took my vaccine. I think I took my vaccine. Yeah. I think I took.
Yeah.
But it was a bit touristy lah.
Okay, I hope you guys learn a little bit or more about flu. And if you guys have any more questions about flu or any other medical questions you want to ask Dr. Lye or any of our staff, please put it down in the comments below, and hopefully you guys also can ask and share what topics you guys want to hear next episode lah. Okay, thank you so much. Thank you for our guest appearance, Gowie and Eder, for today. Alright,